This is an interesting case of a 10-year-old boy who came to see me with traumatizing his front teeth. His two front teeth, number 8 and 9, were not evulsed but traumatized. They were pushed back and he had some pain. So we did some testing with thermal, hot and cold, and percussion palpation test sensitivity, and told him to come back in a couple of weeks, and I was going to retest it. Seemed like everything was intact. So he left the office back in '09, about a year and a half ago, and I didn't hear from him back till about a year later. Came in, and I took another picture of him, and this is what the picture looks like. So what was interesting to me was if he had a root canal done, which pretty much looks like they packed it very well with calcium hydroxide, or it could be that Cal Plus, or it could be gutta percha. So I called the general dentist, and yeah, he said there's a calcium hydroxide paste, and back 6 months after he was in my office, he developed a abscess, and he developed swelling, and he went back to get that treated. So they opened the tooth. It was actually a pedodontist. So he opened the tooth and placed calcium hydroxide inside the canal, and as you can see, within a year, where I saw him on the last picture to this X-ray, the APCs are closing up. And you can tell that the apex of tooth number 9, it looks like it's closed up, and pretty closed up on tooth number 8. One thing that comes to mind as far as treating immature APCs or immature teeth that are on kids is to be very conservative, because they have a lot of blood flow and they can survive on their own, especially with tooth number 8 on this patient. Tooth number 9 developed an abscess, so it had to be treated. So we went ahead and redid the root canal, or did the root canal on number 8 or number 9, and this is how it looks. A little bit of a lateral canal, and that's how it ends it right there. So that looks wonderful, and he was doing fine.